Guys, this is Mobeen from Drbeen.com. Today we are going to talk about a very exciting topic that some of the students have been asking for some time, and that is the ivermectin and the study done in Australia looking at the ivermectin's effect on SARS-CoV-2. They have said, they have claimed that the study has seen within 48 hours 5,000-fold reduction in virus replication or virus presence in the presence of ivermectin in vitro. In vitro meaning in a test setup, not inside a body, not in vivo. So let's look at that study and see what they have to say. Good morning, Chantal from Australia. Today we're going to talk about Australia and the study of ivermectin in Australia. So hopefully you would enjoy this. We should talk about the Australia itself someday, about their control of the disease and how they're doing. So we'll do that too. Okay, so good morning, Hiba, as well. Thank you very much. Let's start our discussion. Today we're going to talk about ivermectin. Here is the study that I am referencing. The study is here. I think that the title is a little bit deceptive, that it says the FDA-approved drug ivermectin inhibits the replication of SARS-CoV-2 in vitro. So in vitro is important because it is in a test environment. FDA approval for this drug is really for the worms in our body and not for the SARS-CoV-2. So hopefully that is clear to all of us. Let's look at the ivermectin as a drug first, and we'll go over the study later on. Again, the standard disclaimer that this is a drug. It can become dangerous as well if you self-medicate. So please don't self-medicate, and this is not a prescription. So let's start. Ivermectin, it is an odorless, highly lipid-soluble white powder. Lipid solubility is interesting because that allows the medicine to be able to go into the cells and work there. Elizabeth, good morning from California, or good evening from California. I'm in California as well. Tariq, good morning from Russia. Wow. All right. So back to the ivermectin. It is active against invertebrates or worms in us. Although I'll note here that there are some in vitro studies that have shown that it has shown promise to work against HIV, then simian virus, then dengue virus, and West Nile in vitro. And also, to make sure that we are all on the same page, it has not shown much effectivity against dengue virus. So with this, the point of saying this is that the drug seems to have been able to work against viruses as well, in addition to working with the worms. So here we have, good morning from Turkey. Good morning back to you. Kelly, good morning. Hello. So if we look at how it works on the worms, it is actually a very interesting thing. What it does is it binds to glutamate-gated ligand chloride channels and causes paralysis by hyperpolarizing the muscle and nerve cells. So let's look at that, what happens. So let's take this worm. This worm is a happy worm. He is sitting in our body, or it is sitting in our body intestine and infecting us, or in the eye. So there are many types of worms that do these things. So let's take a muscle cell of this worm. So let's say this is a muscle cell. On the muscle cell, there are chloride channels. There are chloride channels which are ligand gated. That means something can bind with those channels to open them. So they are ligand gated, and we are interested in one specific channel, which is the GABA gated channel. So this is a GABA, gamma aminobutyric acid gated channel. And before talking more, this is the reason, the GABA gated channel attachment is the reason that this drug is contraindicated in people with a compromised blood-brain barrier, because, for example, patients of meningitis, because the drug can cross the blood-brain barrier, and then go and attack or attach to the GABA channels in our brain and cause our brain's activity to malfunction. This is also the reason that this drug is contraindicated in pregnant women or lactating women, because the baby, the forming baby or newly delivered baby, has an immature blood-brain barrier, and if this drug crosses the blood-brain barrier and goes and attaches to their GABA uh, uh, channels, it can cause malfunction of the brain system. So blood-brain barrier compromised patients, for example, meningitis patients or pregnant women or lactating women, should not use this drug. All right, so back here. So what happens is ivermectin, ivermectin, this drug binds. So let's say this is the drug ivermectin. It comes in and it binds to the chloride channel, and it causes the influx of chloride in the cell. Chloride is a negative ion. When it comes into the cell's polarity, cells becomes hyperpolarized. When the cell becomes hyperpolarized, it becomes difficult for this cell to become discharged or become active. So action potential is the mechanism by which a nerve cell or a muscle cell functions. Action potential generation becomes difficult because the cell is hyperpolarized. So now the cell is not going to function very well because it is more negative inside because of the open chloride channels, and that is going to make this cell not function. The result of that is that the nerve cells and the muscle cell in the worm, they become hyperpolarized and they do not function correctly. That causes the worm to become paralyzed and die. The good news is that this function is primarily active in the worms and not us. For example, if I take that medicine, it will not do that kind of a function on my cells unless it crosses the blood-brain barrier and goes in the brain. It doesn't do that to the peripheral tissue that easily or in the therapeutic doses, but it attacks the worm's nervous system and worm's muscles about 100 times more, with 100 times more potency in the therapeutic doses. That is why it kind of kills the worms. So that is the basic function of ivermectin. Now let's look at what are the doses of this drug. And again, these are anti-worm doses, not COVID-19 or SARS-CoV-2 doses. Good morning, Zizi. So here is what it is. 150 to 200 micrograms per kilogram body weight is given once a year. In some worm infestations, it may be given twice with 1 week's gap, and that's about it. Some studies have also seen every 6 months of administration, but the approved therapeutic procedure for this drug is to administer that once a year. So in this dose, it is usually pretty safe when we are giving it as annual doses. It is contraindicated, as I said before, in pregnant women, lactating women, and the people with the compromised blood-brain barrier. These side effects, look, I drew some nice cartoons here. So it causes itching, that is here, and swollen and tender lymph nodes. However, if you administer aspirin or antihistamines for about a week, this condition goes away. So it's a temporary condition. Then, and this happens in about 5 to 35% of the patients. So acoustic therapy says the concern with HCQ was that it could work in vitro, but you could never get that serum concentration of the drug in live people without being dangerous. Is that you're talking about ivermectin acoustic therapy or hydrochloroquine? Chantel, thank you very much for the drawings. So this guy has itching and this guy has tender lymph nodes. They may be the same people. Now, In rare cases, the side effects can be more severe. Normally, it is just itching and lymph nodes, which can subside, tender lymph nodes, which can subside in about a week. In more rare cases, it can cause edema of the face and peripheries, that is one. It can cause a high-grade fever. It can cause dizziness, headache, tachycardia, and I should be able to spell tachycardia better. There are some people who put the comments saying, you do not know how to spell. Well, I would not want to listen to you anymore. So they don't know that I'm a doctor. I also do not know how to write. I usually write like this. So tachycardia, hypotension, myalgias, that means muscle pains, and arthralgias, that is joint pains, and diarrhea. So these are, good morning. So these are its adverse effects in rare cases. Now with this, with an understanding, so yeah, I'm a doctor. I have to actually make an effort to write this neat so you can read it. So here is the study on SARS-CoV-2. I'm going to go and show you the study once more. Let's just go over the study quickly. What they are saying is this. They are saying originally identified as inhibitor of interaction between the human immunodeficiency virus, integrin protein, a protein on that virus, and the importin heterodimer responsible for nuclear import. What they're saying is that in our nuclei, so let's say this is our cell, inside the cell is our nucleus, and virus needs to get into the nucleus, for example. And what happens is that virus combines with a transporting mechanism, which is called IMP beta 1 and alpha complex. Virus attaches to this complex, and then there are nuclear pore complexes. There are nuclear NCPs, we call them. They are simply holes in the nuclear membrane. So this complex of the virus with the importing proteins that travels through this nuclear pore complex, NPC instead of NCP, and enters in the nucleus of our cells. Over there, the importers or the transporter proteins, they fall apart, and the virus proteins end up here, and they do their function, whatever they want to do. So this is the way it has been working. So the drug ivermectin, what it does is it blocks this process. By connecting with these two guys, the importer complex, ivermectin connects here, and it kind of prevents the virus from connecting and going in the nucleus. So the study says that they've observed this. I believe this is in vitro, not in vivo, not in the bodies. So it's outside. They've seen that activity against HIV. They have seen that activity against West Nile with dengue fever. And I want to make sure that we are all clear. This drug has been tested against dengue and has not done anything useful. So I'm talking about dengue, not about SARS-CoV. And again, for SARS-CoV as well, the study is in vitro. It is not in the human bodies yet. And so the safety and efficacy and the proper dose has still to be figured out. So we need more studies. But these are the viruses: dengue virus, West Nile virus, HIV virus, and a ton of other viruses that it has shown to reduce their proteins entry into the nucleus, and so reducing the replication of the virus. Now here, studies in SARS-CoV-2 patients. So SARS-CoV-2 cells, not patients. It's in vitro. So let's look at that for a second. What this virus does is coronavirus so let's say here is the complex of beta 1 alpha proteins. This is a nucleus of our body, a cell. I have not made the cell for clarity. What happens is that the virus proteins attaches to this complex, and then through the nuclear pores, this whole complex enters the nucleus. Inside the nucleus, the virus protein, which I've made here as well, the virus protein causes the defense mechanism of our cell against the virus to become disabled. So what that protein is doing from virus, how clever of that virus, what it does is it sends a protein in the nucleus which goes and inhibits the nuclear function of our cell to kill the virus or to resist the virus. What they have done is that in that study, they postulated that the drug ivermectin connects with this complex and makes it unavailable to coronavirus proteins to connect. The result is that the coronavirus or SARS-CoV-2 protein cannot enter our nucleus and it cannot go in there and inhibit the cellular resistance mechanisms. I hope this is clear. It is the cellular resistance mechanism of our cell that the virus SARS-CoV-2 inhibits by sending a protein in the nucleus that does that function. And the ivermectin disrupts that activity. It stops that protein from going into the nucleus. So that is a function. So what they had done was they did that in vitro. So here is a cell culture with the coronaviruses in it, plus they put the ivermectins in it. And what they did was they observed the presence of the coronavirus proteins inside the cells and inside the fluid outside. And they found that after 48 hours, the presence of the RNA proteins was reduced 5,000 folds. Now, important thing to keep in mind, what they are postulating with this, what they are hypothesizing with this is that this drug will be useful to reduce the viral load. They are not saying that it would actually kill the virus. They are not saying that it would stop the virus. What they're saying is that it would reduce the viral load so that the number of viruses are not overwhelming for our body, and that allows the body's immune system to generate enough resistance to function. Similarly, they are also postulating that individual cells where virus is infecting them, by blocking the viral proteins to go into the nucleus, the function of the virus to reduce the cell's defenses will not happen and cell will be able to protect itself better. That is the study. So let's look at the study here. So studies SARS-CoV patients has revealed that there is a potential role of importin alpha and beta 1 that takes the drug inside. So I'll just go here to their diagram, which is very similar to the diagram I made. So if you see here, what they're saying is that this is the importin beta 1 and a coronavirus proteins attached to this and go into the nucleus. Over there, they reduce the nuclear defenses and cause the virus replication to increase. When the drug is present, it connects with this complex, does not allow the coronavirus proteins to connect, and so the cell can defend itself better. Here, this is their postulation. Here is their result. As above, a greater than 5,000 folds reduction in viral RNA was observed in both supernatant and cell pellets from the sample treated. Supernatant is the fluid in that culture or liquids in that culture, and the cell pellet is the cell itself. So that is what they found. Within 48 hours, 99.98% reduction in the viral RNA in these samples. And they also said they have not found any toxicity to the cell with this dose. And I wanted to then finalize this discussion. This is a WebMD article, and I'm just taking this part of that article. They talked with a doctor about it from Baylor College of Medicine, Dr. Weatherhead, and her comment was that this seems interesting, but what we need to understand is that what is the right dose that is safe in human beings to be used against this virus. So that is the discussion today. Short and brief. I hope it is useful. What do you think? So I'm done with the talk today. We will continue our discussions with asthma and COVID-19 and hypertension, cardiovascular system issues, and so on. So we'll continue our discussions, but I wanted to make sure. So my opinion, this drug seems promising. We should do some studies. Ivermectin in smaller doses, yearly doses, is actually safe. But what we have not seen is that what should be the dose for a single person, how many times it should be given, what is the side effects that it can cause, how to manage those side effects. But it seems to be just like hydroxychloroquine. This is a drug that should be administered early on, allows the viral replication to reduce, and causes our cells to be able to defend themselves better. This is the discussion. Thank you very much. Thank you. Absolutely. So the dosage, so according to the acoustic therapy, yes, the dosage of the drug and the safety of that dose is something that is important for us to figure it out. So yeah, Kelly, I do not know what that discussion was. That the green tea has quercetins in it, which may be useful for zinc to enter our cells and do some protection against the viral replication. But I have not heard of the tea being generally antiviral. So that is the Gangapathi's question, that can drinking tea 3 times per day reduces the chance of contracting the virus? Well, green tea with zinc can be useful. Actually, quercetin is found in green tea. It is also found in things that have red skin. So red apples, other cherries, berries, those things that have red skin, they have a lot of quercetins in them. So quercetin with zinc can be very useful. So, well, then there'll be a Darwin Award. Yes. So I haven't seen that this drug has been used in the HIV. Correct. Correct. So again, ivermectin in the given doses that they used is not, they postulated that it may be safe, but they have not said it is safe, and there are no more studies I'm seeing. So maybe it is my ignorance. If you know about those studies, please put them down there. So acoustic therapy, that is a very good point, that if we have asymptomatic transmission, that means a lot of people would receive COVID-19, become immune to it, and now they can, number one, hinder the further progress of the virus. Number two, they themselves are immune and they can go out and work. So that is a very, very good discussion or thought. The Santa Clara County, where I live, they had done a study which I discussed separately in asymptomatic patients title. And what they found was about 3 to 4% of the community, without knowing, has become immune by developing antibodies. Similarly, Netherlands had done a test where what they did was they took 10,000 blood samples and they looked into them for presence of the antibodies to COVID-19. And what they found was that 3 to 4% of the people, so they were the people who were donating blood, so they thought they were healthy. So that means they never developed any symptoms. And that is why they went and donated blood. They already had the antibodies in them. So at least we know so far, with the exposure window that we have, that 3-4% of the population may have already gotten the virus and become immune and become part of the herd immunity. Plus, they are also not going to the hospitals and they're not taking the resources. So that's a good thing. So this is what we have for today. Please comment for what would you like for tomorrow. I have a bunch of topics that I have in mind as well. Please comment, and whatever topic seems decent or important, we will discuss that. So thank you very much for your time today, and I would see you again tomorrow. Remember, we will stay off on Sundays. Thank you very much, guys. Bye-bye.